I can hear typing. Good morning, actually lunchtime. So good afternoon, everybody. Happy Friday. Welcome to another episode of Cisilion Live. I'd like to start by asking you all a question. How are you feeling today? And I really mean that, really, how are you feeling today? Because it's a question that I often get taken up on, in the fact that, it's a question we ask quite a lot of the time without really thinking about the context of what it means. It's kind of said like we might say hello when we pass somebody in the street. And in fact, just this morning, I asked the postman how he was feeling. And we do need to think about that sometimes, particularly in the workplace, because we have to be prepared for what if they say that they're not okay? What if they actually suddenly want to start telling us how they're actually feeling? And it's something that as a manager, as a member of the senior leadership team here at Cisilion, I have a duty to ask my team all the time how they are and how they're feeling. And I think we don't often give that the context. And the purpose of today actually is to try and open that awareness about well-being in the workplace and mental health, and not just at work, but how that's affecting all of our lives. Because if I share a little bit of a personal experience of where this affects me, we're a mid-sized organisation. We're 120 or so people. We're relatively fortunate in that we work in technology. So we work with all of the kind of technologies, remote access, Microsoft Teams, cloud, that have been thriving right through the COVID pandemic. So we've been very lucky. We've not had to lay anybody off. We've had very few people on furlough. And in fact, we've actually grown as an organisation, and we've employed people during that time. But there have been lots of interesting, I guess, insights around that. We've had people that have joined our organisation that we've gone through interview processes, through to them starting, through to introducing the teams without physically meeting anybody, and that's quite unheard of. We have got people that have never worked from home before, people that have worked on our service desk that have suddenly had to work from home. And of course, we've been working with many of our customers who have either not been so fortunate and had staff on furlough for a long period of time, or where they've actually had to close down, or all sorts of things. We've also seen a real different insight into people's lives. And I think, one of the, I would say, positives that I've seen from, certainly from working from home over the last 12 months, is just how much more I've got to know my teams, my colleagues, my customers, my partners, families. I've probably seen their children from time to time popping up in video calls when people forget to blur the background. I've certainly witnessed lots of people closing their office doors when the kids are getting a bit loud downstairs. Something I have to do very frequently. But we've also got to understand a lot more about how people work and live, where they live. Do they have an office? Do they work in the shed? Are they sitting on a shared desk? Are they working in their daughter's bedroom? Those kind of things. So it really has opened a completely different world, I think, to what we're used to. And that, of course, conjures up how people are coping. How are they really feeling about things? Are they stressed? Are they work shy? Are they not able to work during normal hours? And how is that affecting their performance? And how are they treated? And it's something we obviously take very, very seriously. It's something I take seriously as a manager. But one of our customers that we're doing a lot of work with at the moment is Nuffield Health. And the reason I've asked Nuffield Health to join us today is really to share some of their experiences of not just what they see within their workplace, and Nuffield employ circa 15,000 people themselves, but also what Nuffield have seen within their client base, because Nuffield provide emotional wellbeing services to a massive number of corporate clients and of course personal individuals. So I'd like to introduce some of the team in Nuffield today, and again, thank you so much for joining us. We've got Brendan who joins us, who is the professional head of emotional wellbeing. So hi. We've got Dan, who is actually an emotional wellbeing champion. I think you call it a first aider almost for emotional health within the IT services team. We've got Goss, who is the preventional lead in emotional wellbeing, again, very important role, and Claire, who is a business development director. So Claire's role, I guess, is really making sure that other corporations know some of the great services and the great things that Nuffield do, and how they potentially can help your organisation. And again, the reason for this is that there's a lot of stigma still around mental health. I think that the term mental health often conjures up images of people in white jackets in padded cells and those kind of things, and we don't often think about mental health as emotional well-being, looking after ourselves, looking after our people. So this is really kind of the focus for today. We're not going to talk about technology much, a little bit, but we're really going to get some insights into what Nuffield is seeing. So without further ado, I'm going to hand over to Nuffield. And really to kick this off, the question I'd like to pose is, we hear a lot about the impact of COVID-19 on the workplace and in particular around mental health. What are the biggest impacts that you have seen both internally and with the clients that you work with?
Yeah, thanks, Rob. I think just to start off as well, because I'm going to quote a lot of stats that indicate the sort of negative impact that it's had. But I think, like Rob was touching on at the start there, I think this is such a collective experience of distress that we're going through in terms of the pandemic. There's unprecedented is the word we keep hearing all the time, but it is in terms of collective distress. And I think there's a massive opportunity here because it's a collective distress that we can change stuff. And I think the main thing we could change via this collective distress is what Rob touched on there, in terms of that mental health is a lot more than the absence of mental illness. And I think there's a massive opportunity there. But in terms of the impact, it's had a massive impact on emotional wellbeing and mental health. A study that Nuffield did at the end of last year indicated that 62% of us feel that our mental health has been negatively affected by the pandemic. So it's a lot of people. There's an interesting cohort in that research. There was 7% of people said that it was better. I'm not quite sure who they were. It'd be interesting to look at who those people are. But there's 7% that it felt better. So massive impact. Centre for Mental Health has indicated that they estimate around about 10 million people will need either additional or new types of support for the impact of the impact of COVID-19 on mental health. That's 20% of the population. And a lot of people have said that that COVID presents the biggest risk for mental health since the Second World War. So yeah, massive impacts of it. And I think that general sort of impact has probably been amplified recently in terms of the way that it's panned out and entering that lockdown 3. I think what lockdown 3 did for a lot of people, I think earlier on, lockdown 1 and lockdown 2, the prequels, it was almost like easier to see what the rewards were going to be. They were a lot more tangible. Whereas lockdown 3, it was a lot more elusive. What's the rewards here? What am I going to get out of this? And I think because of that, this pandemic fatigue has hit, and we're definitely seeing pandemic fatigue internally with Nuffield and externally across our corporates. This idea that people have dragged themselves into the new year. It was like we were 2-1 up in a football match. Somebody equalised just before full time, and we've had to go into extra time, and nobody's ready for it. Nobody was ready for extra time. Those players on their knees, on their face, on the pitch, that's all of it right now. That's how we all feel. So I think that impact and that pandemic fatigue is definitely dragged into the new year, seeing it across corporates. And the worry for that, for me, in terms of employers and leaders, is that pandemic fatigue then results in something called empathic distress. It makes it a lot more difficult to be kind to yourself and others because you're just too fatigued. And I think that idea that you've got to put your oxygen mask on first before you help somebody else is probably a key message for leaders, making sure that you're looking after yourself at the moment. I think on that as well, a call out in terms of the impact that we're seeing internally and externally is that although I said at the very beginning that this collective distress, it's not impacting us all equally. If you look at it in terms of, and as an employer, the call out is to look at your young people. COVID is massively impacting on young people a lot a lot more in terms of that cohort of people. We've seen lots of research about BAME communities and the impact on those individuals. Anybody with learning differences impacted massively more on their mental health. And a key watch out for me is loneliness. And remember, you don't have to be alone to be lonely. There'll be lots of people in your workforce that maybe are alone and are feeling lonely, or with other people and are feeling massively lonely. COVID is massively impacting on the mental health of those people more. And finally, a really big watch out is people living with low resources. Poverty or living with low resources has always been said to be the cause of all causes of mental ill health, but even more so during COVID, those people that are among your workforce that are living with low resources are going to be massively impacted. And I think finally, if you look at what are the key areas, and we'll touch on this later in more depth, there are certain key areas that we need to start to watch out for, and I'm starting to see it in my clinical practice because I'm a therapist, but also we're seeing it internally and externally, is in terms of sleep problems, alcohol problems, and that, like I say, it touched on in terms of loneliness. Now, when COVID hit and started to hit in terms of Nuffield, and it's probably good to share, and almost like a show and tell today, because we had specific difficulties and challenges within Nuffield. If you look at Nuffield, like you said, Rob, we've got 16,000 employees, but they're across such a diverse workforce. So we've got we've got our nurses in our hospitals and our doctors in our hospitals. We've got our fitness and wellbeing centres, 111 of those, and you've got PTs in those. You've also got people like cleaners, porters, you've got physios, you've got psychotherapists. So just a massive different cohorts. And then also the thing that COVID did, we had some of them that were on furlough, some of them were on part-time furlough, some of them were still fully employed. So in terms of the massive challenges in actually what are we going to do in terms of our strategies for supporting our people through COVID, we had to think very quickly about something that was scalable, so across loads of people, but also it talked to those people where they were and based on their experiences. And I think Gosh can start to talk about how we started to approach that.
Yeah, I mean, as Brendan said, we were facing an unprecedented challenge, and we really had to act very, very quickly to know what to do to support this whole massive workforce of 16,000 people. And so we initially talked to people on the ground. So we talked to the matrons at the hospitals that were starting to see COVID positive patients to get a real sense of what they were experiencing. But then we looked to the research that was available, and we looked at research from the British Psychological Society and the King's Fund. And that helped us to prepare, because we knew that there would be three distinct phases of the pandemic. That there would be a preparation phase, an active phase, and a recovery phase. And during each of these phases, there would be a different impact on our workforce, and therefore we needed to provide different support during those phases. So during the preparation phase, if you can remember to last year, there was that real anticipatory anxiety, but a lot of energy. But a lot of real nervous energy. What's going to happen? We didn't know what to expect, but also a lot of people coming together, preparing for that. And then during the active phase, there were two parts of that. There was the heroics and surge solutions, where everybody was sort of starting to think about what we would do. And there were all sorts of schemes and plans and real positive energy across organisations doing fantastic things, and a lot of baking of banana bread, if I remember correctly, and sharing of recipes. But the other side of that active phase, we knew was going to be burnout and disillusionment and exhaustion, and just that real sense of you can't keep it up. You can't keep up that level of energy and workload for that time without there being a consequence to that. So we knew that was happening. And then we have a recovery and a reintegration phase where we start to deal with the long-term impact of the pandemic. But I think what Brendan described earlier with that extra time was that we thought we were going into recovery. We were planning all these face-to-face meetings, and then we went straight back into that lockdown 3. Never as good as the original movie or the sequel. And then we are really starting to feel that pandemic fatigue and that sense of sort of exhaustion and burnout being potentially there. So for us, we had to create a strategy that was going to help all of our people. And we created a task force. It was called Supporting Our People. We had loads of people on that task force, from emotional wellbeing, physiology teams, our comms team, our benefits team, and our people team, to make sure that we were able to really understand everything that was happening. And again, we used our proposition that Brendan will hopefully share with you to give you a sense of how we sort of implemented that in action.
I just want to say Toy Story 3, while Rob's on mute, is the exception to that rule. Let's not
don't talk to me about my daughter goes to university this year and I can't.
No, I think the point I was going to make, and famous mute button hiccup there, was, you're right, and I think lockdown 3 has been hard in many ways. I think it's made everyone probably more aware of the impact of mental health. I think because of that point of how long is this going to be, and I think I think everyone looked forward to the end of 2020 with that kind of, oh wow, at the end, and actually it's been far worse, right? 2021 so far for many, and I think the cold, wet weather, the dark evenings, the dark mornings haven't helped. And I think it does make you realise, actually, some of the teams that you work with. And I think this points nicely onto your point about how you're supporting your teams as Nuffield. But I work with people that just really struggle to work the workday, right? Because they are juggling homeschooling with their other half. So they are working different hours. They're working 6 in the morning. They may well start and they're stopping for a bit, and then they're probably finishing at 1-2 o'clock because they're then looking after the children, doing homeschooling and taking over. And that's for other staff that don't have children, for example, or don't have children within school, or have children that are more self-sufficient. They don't necessarily understand those things. So I think it's not just about managers understanding. It's also about, oh, that person's never online, or they're always offline. Well, yeah, but they're probably online at 11 at night, or they're online at 6 in the morning. And I think worst case, they're online all the way through, because that point about loneliness. And I think I had a colleague actually during the first lockdown that really struggled because you couldn't see anybody, complete isolation, doesn't live with anybody, lives on his own, lives in a flat, couldn't see anybody. The only window into life that he had was work. So actually he spent every single day, from a productivity perspective, you could look and go, wow, it was amazing, COVID's been great. But that's really not a good place for people to be in if the only thing they've actually got to look forward to outside of probably Netflix and things is working. So I know this is something we were going to touch on, but that's a lot of responsibility, right, for an organisation and for a manager and for a colleague to deal with those people. Plus, of course, the family life and things.
Yeah, one of the things I want to say, Rob, is about 6 months before the pandemic, we released a white paper on remote working and the impact to employees. And what was very interesting about that is it pulled out 3 main things: that organizations should have a policy in place to consider how they look after those home working, and what needs to be in place to support that, both from home setup and technology. But the main and fundamental area was the mental health and focusing on individual traits, because some people just are not wired to be at home for a long time by themselves. Ruminators, and even if they do work from home, there needs to be a switch up in their day-to-day in order for them to function and to be productive. And I think what happened with lockdown is it was just fast and furious came upon us, and there was no opportunity for planning. It was just implementation, get the tech right, get people set up. And for many people, first time ever working virtually, first time using this type of technology, and certainly the first time working from home in environments that were not geared up for that. So that was almost the first phase, is that readiness element, and then that mental health element has come in. And this is where the people are now sharing with their teams and or feeling isolated in some way. So the example you gave around those that have family commitments, businesses have to now allow that flex. Teams have to understand that their colleagues are not going to be available potentially at the same time. So there has been a real shift in the way that we need to work, but we're still very much working through that. So that paper that we had preceding it had a number of solutions in place that still in some ways can't be implemented because we're still in this lockdown environment, but has shed light on, just from an individual perspective, how it affects people and how businesses really need to take into consideration the full demographic that they have in their workforce and support them.
And I think
guys, I was just going to say to the audience, Brendan, we've linked that white paper Claire refers to in the comments.
Thank you, Craig.
Thank you. Yeah, I was just going to say, and that I suppose in terms of actual what does our approach look like? What did our approach look like? It's probably chimes with what Claire just said about that, because what we developed in terms of remote working, because a lot of our therapists are remote workers, and what we developed was almost like a checklist for those remote workers in terms of about environment, about psychologically, what do you need, about what because one size doesn't fit all for remote workers. Some people are more prepared to be remote workers than others, but those that aren't, you can put things in place to mitigate against that risk. So we're happy to share it with anybody that wants it. We did put a checklist together for managers to actually go through with employees. But I think if we just throw the slide up of what our approach actually look like, it does chime with that, because what we try and do is have an approach that covers from enhance, so those that are mentally fit and want to be fitter. So there might be people that are at home and remote working that are actually absolutely fine with it, but they want to know how they can be fitter while they're doing it. And then we had prevent in terms of those that were living well, but they wanted to prevent either stress or the onset of sort of mental ill health, and those that are really, really having difficulties in terms of COVID and the whole change in working circumstances and the whole pressure of COVID, that actually needed treatment for mental ill health. And again, this is what we instigated across our whole workforce. So we made sure that we had interventions that hit the enhance, the prevent and treat, and that would be whole of workforce, tailored sort of focused interventions in terms of prevention. So we had a lot of people having difficulty sleeping, so we have tailored interventions for those people, and then right up to treatment. And again, what COVID really, really focused for us is actually we need to get this right internally in terms of our 16,000 staff, because then we will know in terms of our corporate what works and what doesn't. And that's what it's really been a lesson for, to get it right for our people. And I think I'm really proud, and we won an award for our the way from Legal in General. We won an award for the way that we supported our carers during COVID, based on this proposition, which again is at the very core of it is, what have we got to enhance people's mental health, what have we got to prevent mental ill health, and what have we got in terms of if somebody experiences mental ill health to help them get treatment. And also having the ethos that actually any of us and all of us are on that continuum, day to day, month to month, year to year. So often hear this stat of 1 in 4. So 1 in 4 of us will experience a mental health problem over the course of a year. We don't have that stat in Nuffield Health. We have 4 in 4. We've all got mental health, and mental health is a lot more than the absence of mental ill health. And in terms of then making sure that our approach had something for all, I think Gosh can touch on that.
Yeah, so to make sure that we had something across that whole continuum, within some of the work that we did, we created a healthy work hub, and we made sure within that healthy work hub we had resources relating to physical health, emotional well-being, financial well-being, and social well-being. And in terms of creating a network of people within our organisation that could be our ears on the ground to get a sense of what it was that people needed, because again, we can make those assumptions about what support is needed. You can provide, yoga classes for the whole of your workforce, but if they're not interested in yoga, it's a waste of investment and resources, and it alienate people. So within that, we trained some emotional wellbeing champions, and Dan's one of those that could help be sort of ears on the ground in terms of really helping us to translate our strategy into something meaningful for people across our different and disparate teams. And we made sure that we had comms that were very much tailored to meet the differences of those cohorts. So for our nurses, we had posters, because nurses aren't going to look at their laptops during a busy shift. So we had posters on the back of toilet doors with QR codes to our services. For other people, we had weekly check-in emails. We had all sorts of comms that we needed to tailor. And maybe you can tell us a bit, Dan, about what you did in terms of understanding those needs across your teams.
Yeah, absolutely. So across the IT team, we've got about 150 people in our IT department, so it's a large function. So we decided to adopt Teams, Microsoft Teams. We've got a channel within our IT team called, we rebranded it the Friendly Faces, and those Friendly Faces are effectively 5 emotional wellbeing champions trained by the internal training package that's put together for Nuffield Health employees that want to volunteer some of their time as, and I think Rob touched upon it earlier, we're essentially we look at ourselves as first aiders for people's well-being. So at the time when people need signposting, need a bit of support, we post to our Teams channel on a weekly basis, probably even more frequent than that. But a lot of that is disseminating messages and promoting our Healthy Hub services that are available to Nuffield Health staff. We've got employee assistance programs in place. There's lots and lots of blogs, information available to people. And I think it's just about disseminating that information to individuals. And I think accepting of the fact that not everyone's going to engage in those services straight away. IT, we tend to be quite insular people sometimes. We've got people in developers, we've got ex-clinicians actually that are hospital staff working on hospital systems and applications and that sort of stuff. So we've got a real spread just within IT alone. But I think with Teams, what we do is we promote some conversation about things. I mean, only recently we've had some people suffering some of the fatigue of this lockdown in terms of homeschooling and feeling a bit guilty of not devoting much of their time to their children, and that's affecting them and feeling a bit guilty about that sort of stuff. And you know, with that in mind, some of our senior leaders actually saw that post to our Teams thread. They bought into it. They talked a bit about the services available to us, and that's a lot of what we do. It's primarily signposting, but it's also to listen to people. So as a IT manager myself, you know, we're encouraged to talk to people without, you know, an agenda, a pens down meeting, just to see how people are. And I think that's really important. It's about the culture that you kind of drive and instill in your team. So that's some of the stuff we do.
And that's a really good point, actually. Sorry, Rob, go on.
I was going to say, Dan, I think, you know, it's a really good insight from how that kind of operates on a team level, because I think it's very easy to kind of jump in and say, well, you know, it's about just about having calls with people. It's about creating a forum in which people feel they have a voice and they can go and get support. And I'm sure, you know, many of us will have, you know, WhatsApp groups or whatever with friends and things like that. But I think from a professional perspective, you know, having a forum whereby everybody gets a feel, back to the point I made earlier, and actually everyone's getting an insight into the real part of a person rather than just the corporate face that they typically see. Could you touch on a little bit just some of the you know, wouldn't be a Cisilion Live without talking a little bit about technology, but you touched on the way obviously that you've been utilizing, you know, technologies like Teams to do that. Are there any other things that that you've kind of harnessed or you're looking at as an organization that our viewers may learn a bit about or want to look at?
Yeah, certainly. So one of the things we do as an organization is actually we learn from working with our own staff and the support we have in place, and the services that we have available both to our clients. We almost trial some of those enhancements through our own staff, and certainly through lockdown, what we had available to support both emotional and physical well-being, we were able to then translate into our corporate community. So examples of what we offered our staff, which is available as part of our general services, is the likes of online self-managed programs, so the likes of Silver Cloud for emotional well-being. So that is where people are going through some episodics of stress. It just allows people to go through the programs, highlighting the lifestyle areas that they're potentially struggling with at that time. And that was adopted through lockdown by some very large organizations who had staff on front lines, for example. So they were experiencing similar to what we were, and be able to adapt that for them. And then also, pre-pandemic, if we were doing treatment services for physiotherapy, emotional well-being, even our health assessments, there's always a feeling when we're talking to corporates that unless it is face-to-face, somehow remote services are somehow diluted. You're not getting the same interaction. And that's something we've countered through this time. So we always had remote services available, be it VGP, our physiotherapy for certain elements of physiotherapy we can deliver, and for emotional well-being. But with the lockdown and the inability to work out of our medical centres, we were swiftly able to move over to those platforms. And then we looked at enhancing those platforms. So it's more than just a video conversation or a telephone call. It's active engagement, there's tracking and compliance, and also push notifications through those as well. And I think we've done over sort of 20,000 hours of physiotherapy online, emotional well-being. I think the stats are really high with how that's been adopted. But more than anything, I think we're understanding that's now removing barriers in terms of access to care. So people have those options, and when we move back into a normal environment, whenever that tends to be, is people have that flexibility to just simply move between those. They're not one particular service line, they flow together. So whether they're at work, whether they're at home, whether they're out and they want to access our clinics, we are able to actually look after them. And we've got either the continued face-to-face elements, or we can do remotely. But people have seen the value that actually having a clinician talk to online, getting that support and treatment, avoiding any delay and exacerbating issues, they're able to access that. And that has been a big takeaway for us. So in addition to the online therapies, the Silver Cloud, we've also, we're just about to launch an employee COVID rehab program to allow people who are suffering long COVID symptoms. And that will be going out to our corporates before the end of the month as well. And then just very simple measures in terms of ensuring we're running regular surveys, making sure we're getting a temperature check back from our employees. We do them, I can't remember the frequencies, but they were certainly around 3 to 6 months. Now doing them more regularly, and that's been tracking the flow of the pandemic. So we've got a wealth of data from our own employees. And when I'm talking to clients about wellbeing strategies and their reopening, we're certainly drawing on that experience and able to share what we've learned from our services. So that's just a snapshot, Rob, of what we've been doing through the last while, and that step change to accepting remote services as a viable option.
And Claire, that's fantastic, and I think I'd like to call out and just ask the audience as we come towards the end to please do post any questions that that you may have for the panel while we've got them here. I guess while we're waiting for that, a question I would ask is just you touched on there some of the services that you provide to others, some of the things you provide yourself, some of the technology that is used within the tool space that you've already got. There is a lot of information out there, right? We're going to share some links throughout this session for hopefully some information that can kind of help. You've got some white papers, you've got guidance for managers. Could you just introduce a little bit about how you work with organisations, right? Because a lot of the time the information's there, but it's what you do with it and actually how you turn that into something actionable that can make a difference to people.
Certainly, and I think depending on the industry, organisation size, and certainly budgets will influence the investment in people. And I think it's looking at the core of who are your staff, what are you looking to have in place to support, and we recognise that a whole of workforce offering has to be taken into consideration, but actually early intervention, detection, and then ability to signpost to treatment services really need to be taken into consideration. I think there's often niceties around strategies, which is great, and it makes people feel valued. But I think as we move into this next phase, we have to really consider looking after people's physical and mental health, having those strategies in place. And we have something for every budget that we look for with our services. We'll certainly consult on that. But the wealth of data in having those services in place actually starts feeding into an overall wellbeing strategy, so you can focus your efforts in the areas where it's needed and direct your budgets in that area. And that's certainly something I do working with clients as we evolve their wellbeing strategy and looking after their people.
But I think for me with our corporate clients, it's about what have you got already,
mm-hmm.
and how does it hold together. And for me, the big thing for me is, and what holds that together is your employees having a shared language about mental health, because mm-hmm. you can have all the fancy interventions that you want, but if somebody doesn't feel comfortable about talking about their mental health or asking for help, they won't use them. So I think the core, in terms of core for us, and even within Nuffield, and bear in mind we've got lots of doctors and surgeons and that don't want to talk about mental health. We had to make sure that when we developed a learning platform, just so we've all got a shared language about mental health.
Mm,
and when we talk about mental health, we mean a lot more than the absence of mental illness. And it's something that you can look to improve in the way that you can improve your physical health. And I think being able to have that shared language and a dialogue about it, and almost saying to our employees, actually, we expect and welcome you to talk to us about mental health. You need that first as a stepping stone, because otherwise mm-hmm. all the other things will be wasted. So that needs key and language, and we've recently released a paper called More Than Words that talks about that, and I think we can release to people that are watching in terms of actually what does that look like in terms of a business. How do you adopt that different language around mental health that just isn't about mental ill health, it's about mental health in the same way as physical health.
And I think it's that going back to the point you made right at the start, Rob, you know, when you ask that question, do you have that genuine curiosity about the answer? And do you have the confidence in knowing what you're going to do with that answer? If somebody says, no, I'm not okay. And I think people overcomplicate it with mental health. It doesn't have to be that difficult. There's some real basic things that you can do to build that culture within your organisation. As Brendan said, that those conversations are just very, very natural and they're not scary. And that then you don't have to be a therapist as a manager to deal with those problems. You just know how to listen effectively and signpost. And those are skills that anybody can learn that can make a huge difference during any time, but especially during a time when we know that services are going to be needed more than ever.
And just really quickly, I think ironically, COVID has probably thrown up a number of subjects that act as a gateway into that conversation about mental health. One of them is alcohol, because alcohol has increased during COVID, but it's a good gateway into talking about good mental health. And the other one, and I won't stop going on about this ever, businesses really need to wake up to sleep. Sleep is a real, for me, sleep is a gateway into mental ill health, but sleep is massive in terms of a gateway for conversations. So to be able to talk to your employees about mental health, it's a lot easier to start with sleep, because it's everything. We all want to talk about how badly we slept, or do you know what I mean? People want to talk about that, and it's a really good gateway into talking about mental health.
I'd agree, Brendan. When we run sessions where we're doing any webinars, or when we were able to see people face to face, the sleep sessions would always be at capacity. So it allows us to talk about so many things, not just mental health, but the impact of physical health, nutrition, all those elements. So when we're consulting with clients, that's something that if it's not currently in their language, to be able to openly talk about mental health, there are other ways you can start bringing it in, and then it softens that language. And I'll say this, 10 years ago, we formally asked not to mention mental health when we were talking about certain subjects, and find euphemisms or weave it in with something else. And I'm so pleased to say that those organizations now are leading the way in their industries in talking about mental health. So there has been a real change over the last 10 years. And I am hoping with the outcomes of COVID that it starts driving more of those behaviors. And we not just for mental health and physical health, but actually recognizing that as humans, as we're sitting now in our own homes, recognizing that all the moving parts that, when we bring our authentic selves to work and what we're doing, that we have families, that we have the impact of being a carer, and how does the future of work change as an outcome of this pandemic, but then how do employers respond to that?
I think you're right, Claire, because I think everyone has kind of said COVID-19's been the biggest working from home experiment the world has ever seen, all at the same time affecting everybody. But it will change the workplace for good. I think obviously some sectors will have to go back to the way that they were working because of the nature of what they do. Others will change indefinitely. We've got clients that are never planning on reopening offices, that are planning to sell off what they've got, shut their leases down, or at least restructure the way those locations are to have more inclusive meetings so that they can support the hybrid work. I really do hope that that some of the things that you've touched on there remain true, and actually that this is not been seen as a mental health and awareness has not just been seen as a COVID-19 thing. As you say, it's great to see that you were publishing white papers. Maybe you could see into the future, but around actually the impact of remote work, because you're right, it is something that's not brought up. I think as we wrap up today, I think some of the bits that I think have resonated certainly for me are about firstly really being aware of your teams and people you're working with, and how their personal life and struggles in their personal life, whether that is homeschooling or lack of places to work or loneliness or whatever that might be, may impact their performance, their attitude, their behavior, and therefore how you adapt and support those things. I think the other point that came up in this session several times was about the importance of self-care. And I'm going to throw a bit of geeky tech in here as well, because I think we were talking before the session today around, how Outlook had reminded me that I didn't have any lunch breaks booked, I didn't have any focus time, I didn't have any study time, and I'm and I beat myself up about these things because I want to learn new things. I'm constantly trying to learn things. I do want to have a lunch break to go and spend some time with my wife and my children, and I suffer from sleep. I have, everyone that knows me knows that my children get up very early in the morning and obsessed with trains, and I end up at our local train station most mornings at 6:30 watching trains. But I think all of those things are so important to the way that we work, and I think there is a lot of help out there. I think it's great to see that not only are Nuffield leading in this, and I'd obviously expect you to, but the fact that you've got this wealth of services that you can provide to other organisations, just to, at various different levels, right? And I think we're going to provide some information on that as to how other people can get some assistance. And I think just one thing I've taken away from this, and actually something that Craige that does extremely well, I've noticed, and we've had a couple of these in the evening. No alcohol consumed at all, but is these regular catch-ins, just with even with people that don't report to you or you don't report into, but the importance of just keeping face with people and checking things are okay. And Craige and I had a couple of hours one evening once our children were in bed, actually, and it was fantastic. And I think it does kind of create a real sense of being and belonging, and there's someone else that's got the same kind of things or going through the same kind of things as me. So I think that for me has been a lot of the takeaways that I've kind of got from this session today. And I think before we close down, I think I'd like to say thank you firstly for Nuffield for taking part in this and sharing some of those insights. And I think we'll follow up with these with some additional information. And I think we're gonna come back. So the next session we do, we're going to have a look at some of the technologies that exist out there today to help managers be more effective, to help staff and colleagues take better care of themselves through some of these things that we touched on today. But before we go, I'm just going to sort of walk around the panel really. Any final words of wisdom, advice, tips for anybody?
I was just going to quickly say, because there's a really good comment in the comments thing about do we think that the responsibility of mental health is a shared responsibility between the employer and employee? I think it's a really good question, because I think it shows how things have started to shift. I think mental health was often seen as a responsibility of the employee. It was something that wasn't work related. And I think increasingly now, savvy and smart employers are going, actually, we need to attend to it because it's the right thing to do. Morally, it's the right thing to do to look after people, but also business-wise, it's the right thing to do in terms of retaining and attracting the right people. Because increasingly people look, and there's a comment there about salary, people look more than salary. It's like, how are you going to look after me as a whole person? But then increasingly, if you look at something as simple as sleep, if you have 7 days poor sleep, you're 1,152% more likely to be absent, which is going to have a massive impact on your productivity. And in terms of the impacts of mental health on productivity, bottom line, it is impacting on employers. So not is it only the right thing to do, morally, but it's also the right thing to do business-wise. So I think increasingly things will, and I think they have done, that they will move. So I think it is a responsibility of both. There's personal responsibility on me to look after myself, but there's a responsibility on the employer to provide stuff to help me to look after myself. But I think it's a really good question, Alan. Thank you.
And it's a really good question. It comes up a lot in our mental health awareness training for managers, and that's something that we help teach people. Where's your responsibility, and where is that responsibility of the employee, and how do you navigate that line? My top tip, Rob, is it's simple. It doesn't have to be that difficult. don't be frightened of mental health. Whatever images it might conjure, however uncomfortable it might make you feel, it's not that difficult. There are really simple, basic things that every organisation can do, regardless of budget, regardless of size, regardless of the diversity of their workforce, that can make a huge difference, and not being frightened of it. And it doesn't take a lot for you to have the confidence to be able to answer those questions of, actually, I'm not okay, and know what to do to really support your employee in a way that's right for you and your organisation.
Brilliant. And Dan, you're working with plenty of IT people in your group. There's plenty on the call. What would be your top tip for IT professionals at this time?
I think I touched upon it earlier. It's accepting the fact that not everyone's going to kind of reach out for services straight away. It's just signposting and making sure that people are aware of what is available to them when the time comes. I think we spend a bit of a time in our internal support bubble thinking about how we can make things land in a different, more creative way. But I just don't think some people might actually be happy and content with the current situation and the way it is. So it's just making sure that when people do need that virtual hug or bit of support, that we do reach out. And I think that goes back to the point around, pens down call to somebody, anybody, whether they're in your team directly or outside of your team. And actually makes you feel better as well. I found, reaching out to some of my colleagues who I've not actually spoken to before, but through video calls, you actually see their face and you get to speak to them. So I'd urge people to do that, not just managers, but anybody. That's what I would say.
Cheers, Dan.
Just the last topic from me, I think, focused on the mental health aspect is, as a manager, consider that if someone raising a mental health issue, consider if they were telling you that they'd hurt their finger, they'd hurt their hand, they had the cold. How would your response be from a physical health point of view when someone was saying, I'm a little bit anxious, I get panic attacks, or I have an existing mental health condition and I'm dealing with that during this time? So look at it from a duty of care aspect, and also look at it as there is signposting, pathways, treatment services out there that will allow this person to be effective and functional in the workplace, as well as anyone who has just broken an ankle. So allow people to have the space to get those treatment services and know that they are still a valued and functioning employee.
Love that. And I think the commonality between all those answers is empathy and kindness. We're all humans. We're all going through the same thing. But we've run out of time, unfortunately. So I'll hand back to Rob to wrap up and talk about our next session. But from me to you guys, thank you so much.
Thank you.
Thank you,
everyone.
Rob, you're on mute again.
I must learn how to do that. Thank you so much, Nuffield, for presenting. Thank you for everyone for listening. We will be back in 2 weeks' time to talk about some of the technologies associated with these things as well, and to try and link these back to some of the topics that came out today. So please do like and subscribe. Please check out some of the really useful resources that Nuffield have kindly shared with us in the links. And if you want to get in touch with us or any of the team at Nuffield, then please do. Thank you very much. Have a good rest of the day and have a nice weekend. And I hope you're all okay.
Take care, everybody.
Cheers, everybody. Bye.
Thanks, everyone.
Bye.